Hello, bundle birthers. My name's Sarah Lavonne, and welcome back to my YouTube channel. I have briefly mentioned this topic in a few coffee and questions videos in the past, but this definitely needs its own video because I know that prodromal labor, or just labor that feels like labor but actually isn't labor, it can be terribly frustrating. And so I want to try and give you some answers and then also some solutions to your prodromal labors. But before I do that, if you don't already, make sure you click that little subscribe button, and then let's get started. What is prodromal labor? Maybe you've heard of this before. Maybe you've also heard of the terminology false labor. So prodromal labor is just labor or contractions that look like it could be labor, but don't lead to you being in active labor, going to the hospital, having your baby. This can be so frustrating. It can be really uncomfortable and really discouraging for people who are so ready to have their baby, and yet we're still not there yet. So let's talk about it. First of all, the definition of prodromal labor is when you have regular painful contractions that don't change your cervix. So maybe you've seen my What is Labor video, and in fact, I'll link them all down below because I feel like they're probably really helpful to watch in relation to this video, especially if you're experiencing these symptoms. So what is labor, when to go to the hospital, sure signs of labor, all about contractions, anything having to do with labor. One of my key words is we're looking for your contractions to get regular, okay? And by regular, I mean regular in strength and frequency. Now, here's where this gets tricky and where I'm gonna try to hopefully make it make a lot of sense for you. For those of you who are experiencing painful contractions, you're like, am I in labor? Am I not in labor? Why am I not in labor? This really hurts. Hello, let's do this, right? So what's happening in the body when we have prodromal labor? There could be an element of just it being normal for early labor. Now, early labor for a first-time mom typically lasts about a day. Second, third, fourth-time mom, less than a day. I'll say maybe 10-ish, 8 to 12 hours. But again, this is very flexible. There is no hard stop for that. I am no genius for labor times, but it gets shorter the more babies you have. And so the normalcy of it is that early labor is that time frame where you get to figure out or your body gets to figure out if they're really gonna do it. It may start and then it may stop. If you're my client, and I do have one-on-one clients all over the world, if they text me with contractions, I'm always like, cool, let's wait and see. And there's sort of this element of you don't know it's actually labor until it turns into active labor, because you may have bouts of 6-10 hours of painful contractions that never get to that peak where you're all consumed, looking more like active labor, but they still hurt. And then all of a sudden after that 10 hours, 2 hours, however long it is, they just they're done, they're over. They're like, that was a nice little trial run, just tease you, get you going, but I'm gonna give myself a break and I'm gonna come back tomorrow. That is characteristic of early labor, okay? Whereas where it's prodromal labor is that regular side, where there's no start or stop. It's just consistently painful over a long period of time, but they're never increasing. So it could be normal, but it's frustrating and no one wants to stay there. You're a lot of times you go into labor excited and energized, yes, let's do it, let's meet this baby. And then 48 hours later, you're like, I'm exhausted. You have no reserve left. And you're like, I'm not even in active labor. That can be so discouraging, especially if you want to go without an epidural. And you're like, how am I going to do it when it gets even harder? I get it. And so I have two approaches here, okay? Two things to consider. One would be that you either try to get things going and you try to stimulate labor to increase pick up, and I'll tell you why and how we'll do that, or we actually want to try to slow down contractions and give you a break. My go-to for prodromal labor, if you are a client of mine, I'm probably gonna encourage you to rest, because resting for you in that early phase, no matter if you're in prodromal labor or not, is so incredibly important. And people get excited. They wanna be like, ooh, yes, labor, let's try all the things they learned in my Coping with Labor class, or they've done through birth coaching, or they've read online, which you can do, but a lot of times very quickly you use them all up and then you're like, oh, well, I'm not actually in labor, which is fine. It's a great practice run, but at the same time, you kind of have the long haul to go. And so we wanna slow everything down, relax, distract, and rest as much as possible, okay? So let's talk about resting and how we rest with a prodromal labor. There's a few recommendations I have for you. The first one would be heat. Any kind of bath water, any kind of heating pad, so long as it's not like hot boiling water, and it's usually, especially the electric ones, are gonna be more controlled. That's gonna be really soothing on your contractions. Now, if you couple that with a position, and by positions, I'm probably gonna recommend an open sideline position. So what that does is it helps open the pelvis, that if baby's trying to get in, and that's usually what's happening with the prodromal labor, is that baby's like, I'm not totally getting in, and I'm really trying hard to get in with these really strong contractions, but baby's not quite engaging. And so we would want to do restful positions. When you lay on your side, a lot of times contractions space out, whereas if you get up, right, and you walk and you move around, or you're just like kind of balanced on either side, not laying on a side, that typically speeds up contractions. Again, flex and flow, not everyone's the same, but in general, if you do a sideline position, throw some pillows between your legs, get in a bathtub. You're not gonna do that in the bathtub, but just rest in the heat and the warmth of the bathtub, or put a heating pad on. That's gonna be really important. The other big one is water, guys. Water is so important, not only for life, but also for pregnancy, because the uterus is super sensitive to being dehydrated. So if you're at all dehydrated, your uterus will likely contract. So we wanna make sure, partners, you're being extra supportive during this time, and you're grabbing that water, passing water or fluids, whatever. It doesn't have to be exact water. It could be juice, or it could be lemonade or something delicious, whatever. Tea is great that you're hydrating, because a dehydrated uterus is an angry uterus. So we wanna keep you nice and hydrated, with the goal of your pee being almost clear. Then you wanna eat, you wanna nourish yourself, you wanna lay and rest. I say in my childbirth class that contractions, treat them like the snooze button. I'm a snoozer for sure. I snoozed a solid like 3 or 4 times this morning getting up. And so when you lay and you rest, just breathe, practice your deep breathing exercises. And then when the contraction comes, just the only thing that changes in your body is your breath. And so you can go to my breathing video for that one and do some deep breathing. And then when the contraction's over, goodbye breath and bye, and back to sleep. Okay. Now, support people, I really want to encourage you for a prodromal labor that she is going to need some extra support here. This can get really discouraging. They're going to need extra distraction, extra encouragement, extra reminders that they can do it. And so you really want to step in and kind of balance that, but also for support people to rest as well, because labor eventually will be here. You will not be pregnant forever. This will not be forever. And so you both want to go into it rested. Now, if it gets really, really bad to the point where you are just beyond exhausted, you cannot sleep, you cannot rest, but you go to the hospital and say you're still not dilated at all. And this does happen. First of all, there's no shame in that. You're doing the best you can, and certain bodies do different things. Other bodies, they're like, I didn't even hardly know I was in labor, right? Flex and flow, but for some of you, that can really be discouraging. You show up at 1 centimeter when you've been laboring for 2 days. Like, that's a bummer, right? There is something in the hospital that you can talk to your care team about called a morphine rest. And now you're gonna have to flex and flow with this one. I'm not making a medical recommendation, but it's a discussion that you could talk with your provider about if this is truly that bad, where they give you some morphine, which is a narcotic. It's a pain medication, right? But it's been shown to calm the uterus, help you sleep, and either it kind of like resets everything in your body, where you wake up from your nap and you're like, oh, my contractions are gone. Or you wake up in like full-blown rip-roaring labor. So it can be potentially very effective. I've given many morphine rests in the hospital, and they've been really helpful as an option for people who are just like so beyond themselves because they've been in labor for so long. The other thing I've heard of, again, not a medical recommendation, but something you could discuss with your provider, is taking Benadryl. Benadryl helps you sleep. And so if you're doing those restful positions and you take a Benadryl in general is safe for pregnancy, but again, check with your providers. That can kind of help to calm you down and sort of give you that extra boost to keep resting, to help recuperate your body, so that when labor actually happens and it turns into that active labor phase, you're ready to go, you're rested, and you're like, okay, I reset my body. I can do this now. So the one option is to try to calm labor down and then just wait for real labor. Or you may decide, look, it's been so long, I'm so over this, I'm not able to sleep, they're not gonna morphine rest me in the hospital, let's try to get this show on the road. Now, this is where I'm gonna send you to my How to Engage the Baby video, which I will also link down below. And that video are all positions that will help your uterus align your baby with your pelvis to help get the baby in, because a lot of times we're thinking the body's really trying hard, squeezing so hard and so painful, trying to get that baby into your pelvis, down and out, and it's not working. So there's probably some sort of misalignment in there. What I'm gonna recommend to you is to stretch, to rest as you can rest. If you're tired, please rest first. So clearly, like, I have a little bit of a bias to this, but to each his own, and you know your body best and your situation best. Different position changes, stretching out your body. You're thinking, I wanna make space. Motion is lotion. So we wanna move that baby in there and move your body and stretch out all your structures to make space so that baby can position and really get into the pelvis. The other thing is, I have 2 videos for you. One is how to naturally induce yourself in labor. That's probably not the title, but I can link that one down below as well, which are all things to help increase your oxytocin or your prostaglandin levels, and maybe enough to just boost you into labor, okay? And the last thing I have for you is what's called the Miles circuit. So I did not make this up. This was Miles somebody, or the last name is Miles. I will link it down below. I may also make an Instagram post about it, but it's a series of positions. So I like to call it a circuit because I do a lot of these with my clients and even as I teach nurses, that it's 3 different positions done 30 minutes each to help to realign and stretch everything to get things going. The last video I'm gonna send you to is the midwives brew. Now, anytime you're ingesting anything to try to stimulate labor, you definitely need to check with your provider, make sure they're okay with it. But there is like a sort of concoction, and really it's just castor oil that is a laxative that can help stimulate your contractions and may push you over the edge. Again, not necessarily making that recommendation, and honestly, I probably wouldn't make it to my clients. I'd tell them not to do it because you end up just pooping a lot and it can be extra uncomfortable, and sometimes it works, sometimes it doesn't. Use at your own risk, but it definitely is an option for you. So if you're experiencing contractions that are super strong, regular, but don't ever increase to the place where it looks like active labor, you might actually be in false labor or prodromal labor. There are things you can do, but you're gonna wanna think and prioritize what's more important here. I'm gonna encourage you to rest, but you may wanna try to get yourself into labor. The other thing is that I wanna remind all of you, because at the end of your pregnancy, it can be so frustrating to be having these symptoms and not dilating, or going to the doctor and they're telling you you're 1 centimeter. You're like, I'm 39 weeks, I'm only 1 centimeter. You are 1 centimeter, okay? We have to celebrate every change in your cervix, and that's not just centimeters, that's effacement or thinning as well. That effacement and thinning really does matter, especially for a first-time mom, but for all parents as well. Remind yourself that you're doing it. Take a deep breath, slow everything down, lean on your support, drink lots of water. And then obviously, if you're concerned, if you have any of the warning signs of pregnancy, go to the hospital and get some more information, help them give you options, and then always be thinking that likely there's a baby that's really trying hard to get down and into the pelvis, but it's just having some sort of misalignment in there. So loosen everything up, stretch it out, squats, lunges, butt stretches, all of that's gonna be really good. And then staying active, motion is lotion, move around, listen to your body of whatever feels right, and eventually, I promise you, you will be in labor. Thanks everyone for being with me here today. If you want more from me, you can head on over to bundlebirth.com. I will link everything in the description box down below, as well as all of my online classes. I have a slew of classes over on my website. You can check that out. Make sure you follow me on Instagram. Make sure you subscribe, give it a like, share it with a friend. And then if you're having prodromal labor, I want you to picture in your head me telling you these words, that you can do it, that you are strong, that you are capable, that this will not last forever, that eventually this baby will be on your chest. Try to remember that. Set your mood and your environment to be one that it feels safe and secure and informed and supported. And then don't forget to flex and flow, and I will see you very soon. Bye. Sound. How does the sound sound? And let's talk all about prodromal labor. Labor. I haven't done this in a minute, but I'm in my studio. We have a pink wall that accents the color of my face. Maybe I soften it. Do I soften it? Does that look better? Ooh, I like that. I'm sweaty and I forgot to put on deodorant. Too big for the chair. Okay. This can be incredible. Sarah. Just gotta get in a flow. Get in your flow. You know how to flow. Flex and flow. Let's bring it back to the olden days of bundle birth filming where we just have all day. We can just enjoy our little lives and drink some coffee. I don't want to mess up my lipstick.